Hey guys, it's Jared Moss with the Regional Urology, and I just want to give you a quick informational video about kidney stones. This is the summertime months, and a lot of times we refer to it as stone season. Typically the reason that we refer to it as stone season is because people are outside, it's hot, we're dehydrated. When you're dehydrated, you're going to be at risk for forming kidney stones. Thus, here in the South or in the Stone Belt, we call it stone season. Anyone who's had a kidney stone before, you want to do everything you can basically to prevent having to go through the pain of passing a kidney stone or having to have surgery for a kidney stone, much less needing stents and things like that, which are all very uncomfortable, and certainly a strong incentive for patients to try to do the necessary preventative things to try to prevent further kidney stones in the future. Common questions that patients will ask is, say, what do I need to do? What do I need to drink? What do I need to eat to try to prevent these stones from reforming? Initially with patients, I try to keep it pretty simple. I find that if you give patients 100 things to do, they're not going to do any of them well. So my biggest thing that I try to tell people to focus on is hydrating and to make sure that you're not dehydrated. The easiest way to do that is when you urinate. If the urine is a clearish color, that means that you're hydrated. You're not going to be forming kidney stones, or you're certainly going to be much less likely. If the urine is really, really dark yellow and you're not making a lot of urine, then you're obviously very dehydrated and you're going to be high risk for forming stones in the future. As far as fluid intake, I tell people generally to try to drink as much water as they can. Fresh squeezed lemonade is also a great inhibitor for stone formation because it contains a compound called citrate, which is very important in preventing kidney stone formation. I tend to tell people to avoid dark colas such as Coke, Dr. Pepper, tea and coffee all contain oxalate, and that is one of the most common things found in kidney stone formation. It doesn't mean that you can't have these at all, but moderation is certainly going to be very important. One thing that I consider kind of a game changer as far as kidney stone prevention is concerned, there's a new, I guess I would call it a medicine, but it's called LithoLyte. This was actually created by Ryan Holland, who is a urologist that did his training here in Shreveport, Louisiana. LithoLyte is basically, it comes in almost like Propel packets, but it has the citrate that is in the packet, and you can basically open the packet and empty it into a bottle of water or the fluids that you're drinking, and it contains a lot of citrate, and it's very, very helpful as far as trying to prevent stone formation. The neat thing about LithoLyte is it does not require a prescription. Most of my patients, I'm telling them to go on Amazon, type in LithoLyte, LithoLyte. You can order it directly off of Amazon. I'm asking the patients to use 1 or 2 packets per day. It's much less expensive when it comes to the prescription form of this, which is known as potassium citrate or Uracil K. They tend to be very, very large tablets. They're difficult to swallow, and they cause a lot of problems with upset stomach, diarrhea. I have several patients that are using this now. They've been very successful with it, not having problems as far as tolerating the medicine, and this stuff really works. So this is a great thing to include in your diet and the fluids you're drinking if you're a stone former and trying to prevent these stones from reforming, and trying to do it with a way that's cost effective, doesn't require a prescription, and is tolerated really well. I hope this has been helpful regarding the prevention of kidney stones. If you have any questions, please let us know. Thanks so much.